Hi everyone, these are some common questions that come up about identifying bones and their markings. So we'll work through a couple of the commonly asked questions. All right, so looking at the scapula first, you'll notice that the scapula has a glenoid cavity. Here it's called the glenoid fossa. This cavity right here is actually what forms the shoulder joint with the head of the humerus. So that always has to point toward the lateral side. Okay, so no matter how the bone is oriented, no matter whether it's a left bone or a right bone, that glenoid cavity always has to point toward the right side. So once I have found that, then I can orient myself toward the rest of the bone. In fact, that's what I would recommend. If you have trouble figuring out parts, pick one piece as the landmark, and then everything else can fall in place from there. So since I now know the glenoid cavity is lateral, I know that this is the lateral border over here. And of course, this is the medial border on the opposite side, meaning that medial border is the one closest to your spine. Now, the spine of the scapula is this portion here that you can actually feel. Okay, that portion is what you would feel if you touch your shoulder blade. There is a piece of bone that sticks off the top of that here. It's called the acromion. Sometimes we call it the acromion process. It is the highest point on this bone. If you've heard of the Acropolis in Greece, it sits atop the highest hill, just like this piece of bone is the highest peak on this bone. So the coracoid process is the lower of the two peaks. It's kind of hidden back here on this picture, but over here you can see the coracoid process more easily. All right, so we now know that the spine has a set of fossas. A supraspinous fossa is a basin-like curve on the top side. It is this region right in here. And there's an infraspinous fossa right here on the bottom side. If you're looking at the posterior view of the bone, there's where you're going to find that subscapularis fossa. Okay, the opposite side, the anterior view is going to show you the body. There were some questions about how to identify bones from each other, especially these long bones. And again, I would use something as a kind of as a landmark to be able to differentiate between these bones. For one, the humerus has the trochlea and the capitulum down here at this distal end of the bone. Okay, that's something I would look for. I would also notice this head up here is not very impressive, but it always sits toward the medial side of that bone. By comparison, the ulna and radius, well, the ulna has a U-shaped scoop kind of positioned here. That's that trochlea or semilunar notch. That helps to form part of the elbow. And the radius has a flat-topped head. You can see the head right here has a flat appearance to it. Now, both of these bones have a pointed styloid process. Ulna's is hidden back there, but those actually form part of your wrist. The ulna is the bone on the pinky side of your hand. The radius is the bone on the thumb side of your hand. So if you feel right around where your wrist is, you may in fact feel the styloid process from each of those bones. The femur is one with a massive ball and socket joint. That one there, that head, forms the ball and socket joint with the acetabulum of the coxal bone. So that's what I look for. It's always on the medial side of the femur. And once I know that, then I know everything on this side down here is also medial, whether it's medial epicondyle or medial condyle. Opposite side, of course, would be lateral. The tibia has a big T-shaped top. You can kind of see it here. Okay, and so this little protuberance right here would be that tibial tuberosity. And then last, the fibula is a very thin bone. You know, if you've ever heard of a fib being called a little white lie, then that's kind of what this fibula is. It's a little thin bone. It does have a knobby end here, that is the head end, and it does have a pointed end. See how that points down there? That is the lateral malleolus. So I know that that portion there is lateral. And this portion here on the tibia is medial. That, in fact, is the medial malleolus. So, of course, that helps me orient which side of the bone is which, no matter whether you've got a left bone or a right bone. These are some good landmarks that you can use. Another question that we discussed was how to tell the difference between all these vertebrae and really what the bone markings are. I just want to point out here, by looking at the comparison of the three, the cervical vertebrae have little tiny holes here. They are called transverse foramen, right there and right there. We do not see those transverse foramen in thoracic nor in lumbar vertebrae. You'll also notice the body, which is this portion here, gets larger as we go down the spinal column. The lumbar vertebrae have the largest body. Thoracic and cervical have somewhat smaller bodies. This is just a typical vertebrae. We know this portion back here is called the body. And this is great. This is color-coded so you can see the pedicles attach the body to the rest of the vertebrae. The transverse processes stick out to either side. Now, you know this is not cervical because there are no transverse foramen here. The superior articular processes are hard to tell when you're looking at a top view of a bone and you can't actually handle it. You would really need to be told if you're looking at the superior or inferior view to confirm that. But nonetheless, these superior articular processes or facets actually help to align these vertebrae with each other, and that's the facet that they rub along when they move. The lamina is this portion here that connects to the spinous process, and when you touch your back and feel your spine, you're actually touching the spinous process. You can see that part sticking out opposite to the body. Another question that we discussed was how to identify the bones that form the coxal bone. So this entire bone that you're looking at here is called a coxal bone. And the coxal bone was originally 3 separate bones that fused during your childhood years. The ilium is the flared portion that makes up what we call our hip bone. Now, there is what I call a moon crater here that's actually going to form a socket that we call the acetabulum. That is the socket in which the head of the femur will fit and forms your hip socket. The hole down below is called the obturator foramen. Now, the ischium and pubis look similar, and they're sometimes hard to tell apart. What I look for is this pointed region right here. That helps me confirm that that portion is the pubis. In fact, the other pubis would be sitting right like this, and there's a piece of cartilage in between that we call the pubic symphysis. All right, and then the ischium, or ischium as some people say, is actually the part that you sit on. And I remember that because ischium has an S in it, while ilium does not. Now, what I look for is a bumpy piece of bone down here like this, and that is the ischial tuberosity. That is in fact what you sit on. So when your butt bones get tired when you sit in a hard chair or on the bleachers, that's in fact what's making contact through your skin and tissues with that hard surface. So look for that ischial tuberosity. That is not, of course, on the pubis, it's on the ischium, and it helps you differentiate the pubis region, which is more pointed, from that ischium down below. Here you can see the articulated coxal bones with the sacrum at the back. This blue portion they've highlighted here is called the pubic symphysis. It's a piece of cartilage that's situated between the 2 pubis bones. So these bones right through here are called the pubis bone on either side. The ischium or ischium is this portion down here, and the tuberosity is the rough part at the back there. What's the name of this socket? That socket we know is acetabulum. And the hole here is called obturator foramen. All right, so in this image, I wanted to show you the sacroiliac joint, which is this joint here between the sacrum and the ilium. So right there, we can find a joint called sacroiliac joint. And of course, this bone here is the sacrum, and this bone here is the ilium. So in fact, like we talked in the previous slide, the pubis, ischium, and ilium fused together after birth. So those actually were 3 separate bones that became one bone, the coxal bone. You can see in the sacrum here, these little foramina right here. Okay, those sacral foramina. And in fact, the sacrum is about 3 to 5 fused vertebrae. So that's why it has some characteristics of your typical vertebra, but looks a little odd because it is in fact fused together. So there's some other bone markings here, but I thought it would be most helpful for you to see how to identify those 3 separate bone types: ilium, ischium, and pubis. Please let me know if you have further questions or other bones that I can help provide clarification on. Good luck on your bone test.